Thank you very much for taking time to view this presentation today. I actually would like to go over one of the bras that we've created with our company, and how this bra was created is I'm actually a breast cancer survivor that went through double mastectomy with reconstruction. And in the course of going through that, I realized that there were no products out there that were available to accommodate the comfort and the healing at the same time. I was actually very miserable. So I sat down one day and took all the things that I was uncomfortable with and decided to come up with a bra design that accommodated the features to get rid of the discomfort so that I could concentrate on healing, or the next patient would be able to concentrate on healing and have some sort of normality back in their life. So the product that I have here today that I'd like to show you is a post-surgical bra. Hopefully this bra will make it where each doctor will only have to stock one particular garment in their inventory. We tried to find an all-around bra that they could put on directly after surgery that would work out well for a patient for any type of chest surgeries, whether it be the breast or heart surgery, lung surgery. It's worked out very well. We've been selling the bra and test marketing it for about 3.5 years with Northwestern Memorial Hospital in Chicago. They were one of our first customers. In the course of the last 3 years, they've actually narrowed it down to using nothing but our bra, and I've noticed that we're actually sending the bra to different departments now. Just recently I started getting calls from cardiologists that are using them for cardiac surgeries and thoracic surgeries. I'll go over some of the features with you and give you the information that our company has on contact information. You can actually view the product on our website. We actually do a very simple ordering process. It's a very simple sizing process that you can actually view on our website. Basically, to size the bra, there are only 3 measurements that the nurse has to take, or the patient has to take. They actually measure across the breast, being here, above the breast, and below the breast. And our bras come in a extra small up to a extra large. Our charting actually takes a very range, maybe from size 32 across here to a 36. Maybe would accommodate a large. It's very size forgiving, so you don't have to be totally precise in your sizing. Just with those measurements, you should be able to cross-reference with our sizing chart. I'd like to take the opportunity to show you some of the features that our bra has to offer. These features came about, like I said, from me being a patient. One of the most important features I think this bra has to offer is that we created and were able to patent one of the features on the side being that the drain comes out from the breast area over the top of the band, and you can actually adjust the band underneath and around the torso up to 3 inches. You can adjust 1.5 inches on each breast. A lot of times when a lady comes in for surgery, it's not always both breasts that are being involved in the surgery. This bra is very accommodating, whether it be the right breast, the left breast, or both breasts. You're able to adjust each breast according to their needs. So the opening on the side brings it out over the top. You can start out accommodating the swelling involved with the breast area and the trauma to the chest area, and be able to adjust the tightness of the bra as you start to heal and the swelling goes down. The drain caddy that we created, one of the most frustrating things for me was when I actually started to go home and shower, there was no way to accommodate those drains and be able to free up my hands in order to shower. So we came up with the idea of what we call the drain caddy. The first band here is to be worn with the bra when you're dressed and out and about. The second band is to be worn in the shower so that you have something to hold your drains and be able to just leave it to dry with your towel until the next time you shower. The Velcro on the side actually comes loose and runs through the top of the drain here, basically acting the same way as it did before on a belt loop. One of the disadvantages of not having the caddy is that you ran it through your belt loop, so naturally, or actually safety pinned it to the bottom of your pajamas or the top of your pajamas or the bottom of your belt loop, so that when you took your pants down, a lot of times in the middle of the night, you forget that that's attached and you're actually pulling at your drain sides. This alleviates all of that, so that you are able to find some comfort and be able to adjust this down as the swelling goes down too. They come in one size fits all. There's actually a surplus of band underneath here. You can take it as tight or as loose as what you need. And this drain caddy works the same way, only they have the Velcro on the side. It comes through and you can actually take your tubing. A lot of the complaints that I've found with patients is that when you have the tubing hanging down out of your clothing, you took the chance of actually catching it on doorknobs, on handles, on the drawers in your kitchen, all sorts of things, which once again, once that happens, you're tearing at those drain sites. This way you can actually bring it up, there's an extra Velcro, and you can loop it and bring it underneath the second piece of Velcro and hold it in place while you're clothed or while you're showering. The next feature of the bra is the top front fastener. This has 3 eyelets section on the front. You're able to adjust this to tighten it at the top or at the bottom. You can wear it as a straight up and down fastening system, or you can actually compress the bottom of the breast or the top of the breast depending on where the surgery is to be able to get the compression that the surgeon needs to hold maybe the implants in place or while you're going through the reconstruction process of the stabilizing the implants themselves. The top fastener, like I said, this is actually accommodating for both breasts. You can bring the symmetrical if the patient has the nature's breast, I call it, on one side, and they're going through the trauma of the surgery on the other breast, whether it be a reconstruction or waiting to wear a prosthesis, they can actually bring everything up to symmetrical balance. Like I said, this bra is to give a patient back some sense of normality, at the same time give them comfort and let them have the opportunity to heal without having to worry about what they're going to wear as a garment, whether or not they're comfortable. And it's nice to know that the surgeons that are using this are sending the patient home directly after surgery with a garment. There's nothing worse than going through surgery and losing both of your breasts and then going home and not having a garment that you can wear out in public after wearing a bra for, say, being a woman for 25 or 30 years. It's very, very important for the morale, and it's very important for the healing process. The inside of the bra also, we put a cup in to hold the prosthesis, and while they're going through the reconstruction, if they choose to do so, they're able to wear something to kind of accommodate that void as they're stabilizing everything that's involved with the reconstruction, the expanders or whatever it may be. And then if they choose not to have the reconstruction, then they have a pocket for the prosthesis. Like I said in the beginning of the presentation, we are trying to come up with a bra that you're able to stock one product. As it be now, in order to accommodate the drains, the only way to do that is either to hook it to the belt loops or to the top of the pants with a safety pin or a belt loop area, or to buy the camisole for sleeping at night, and then you're without the bra, so you actually have to stock 2 products. A lot of the hospitals that I've called on are currently stocking 2 products. This eliminates the idea of having to do that. We have been using these, like I said, for breast surgeries for quite a while and just expanded out to other chest surgeries. The cardiologists that I've talked to, the surgeons, with the breast or the heart surgery, of course, there's all the weight of the woman's breast if they've not had any surgery on their breast. I mean, this is a person that has not had breast surgery that's going in for open heart surgery or any other kind of incision in the chest area. They're able to bring the breast up and be able to compress their chest area and be able to get the comfort of not having the breast weight pulling down on those incision sites. And then also, of course, with the chest surgeries, you have the drains, so you have this accommodation with the drain caddies. Through our design process, I actually worked very close with my plastic surgeon and discussed with her the needs that I felt were needed in the bras, and she brought to my attention some of the features that I want to mention to you now. One of the most important things she mentioned to me was that with the sports back, I needed to make sure that I had support through the shoulder area. She said during the healing process, especially with reconstruction, it's very important that your shoulders stay back so that you don't have any scar tissue that interferes with your reconstruction process. So we were very careful as putting a very supportive sports back on this. Not only were we careful with the design of the sports back, but we tried to keep the seam off of the center so that it was away from your spinal bone area, so that when you have all the swelling going on and you're setting up through all the surgery healing, you didn't have any irritation to your actual bone area of your back. We brought the seams over to the side so that it would actually hit the female in the void area of your shoulder blades going into your spinal area. The seaming that's on this is a very unique seam process that our surgical compression company uses. They actually turned all the seams inside out on this to avoid any irritation with the swelling of the skin and things that are going on in the soft tissue during the healing process and directly after the surgery. They developed a seam that when you pull this apart, when it's actually applied to the body for the first time, the seams actually flatten out on the inside area of the bra. One of the things that helped with this is that you actually have, once again, all of this adjustability here at the torso area and the adjustability that I mentioned to you in the beginning on the front area. Very easy to accommodate the sizing once again as the swelling goes down. You won't end up with a bra that's too big for the patient once their swelling has been subsided, and once the drains are removed, they still have a bra they can wear 6 months to a year out. I would like to thank you once again for taking time out of your busy schedule to review this presentation. And I'd also like to say, as a patient, I know how important it is to find ways for your patient to walk out of your office or your surgical unit and be able to concentrate on healing and be comfortable through that process. So if there's anything our company can do to help you meet those patients' needs, please contact us. We'd be more than happy to send you information or send you a sample of the bra for your review. Thank you.